Today we are talking about what to do when you're setting up to do trach care with your trach or trach and vent child. So I'll be showing you the things that we do, and I will be showing you what we do when we get things ready for trach care and what items that we use. First, we find a surface that we can use for trach care. But I'm going to use some baby wipes. I'm just going to wipe down the surface to make sure it's all nice and clean. Now you can use soap and water, or you can use alcohol wipes. I have a lot of baby wipes on hand, so I just like to make sure the surfaces were nice and clean. Before that or after that, you would want to make sure you wash your hands or put sanitizer on them, just so they're all fresh and clean. Now, these are the items we use. We use nice satin powder. Here are some trach ties. There are Q-tips. Here is our white vinegar. And some scissors. Now, I'm going to cut open this gauze. I'm going to cut open this trach tie. Put the trash over there. This is a brand new trach tie. We do reuse our trach ties as well. This is a brand new one. And this, I recommend the size for an adult. That's why this one is so long. So, I'm going to cut this part off. I'm going to cut this part off and make it, because we already have a piece cut off for our daughter to know how long her neck is, how much she needs. So we know what size our daughter needs. Now I'm going to keep that extra piece there. So my trach ties are here. They are cut. I'm done with my scissors. Now I'm going to open these, but I do not take these out of their container until I'm ready to use them, because this is a sterile bag and they're as clean as they can be inside this bag. They're cleaner than my house, for sure. So I'm going to leave them right inside their bag. Next what we're going to do is we're going to use the acetic acid, and we're going to pour this into I poured it into the lid. So I'm going to pour it into the lid here. One thing I forgot to mention about here is what's really important is when I bring this gauze over here. This is a non-woven drain sponge. As you can see, it's already pre-cut and already has a hole there, and we'll see why in a minute. Leaving this inside the bag is also the cleanest place you can leave it, because it's a sterile bag. But I opened it up. I'm going to look at that, but first I'm going to show you a couple other things that we do. Okay, so I put the white vinegar acid in this cup. So what I'm going to do is I'm going to dip the ends of my Q-tips into the liquid. Then I'm putting it back into the bag. I'm going to do the same thing with this bag. So I have 4 Q-tips. Dip those in the white vinegar. Put them back in the bag. So they're clean as can be until I use them. So those Q-tips are ready to go. Now, there are 2 gauzes in this bag. So, lay one gauze here. I'm going to take one of the gauzes and I'm going to dip. Alright, so I folded it in half. I'm going to dip one side in. Oops, let me do a little mess. Alright, so now one side is wet. I'm just going to take some of the wetness off so it's not as dripping wet. So now one side is wet and one side is dry. Clean around Emma's neck with the wet side, and I'm going to dry her neck, pat it dry with the dry side here. I'm going to lay that on top right there. Now, this trach gauze is going to go around Emma's neck. This gauze here will go in between Emma's trach and her stoma. Now, I'm going to fold it in 4 pieces. So I fold it in half. Then I fold it here. So I got this cute little end here. I'm just going to dip that in the end, because that is the part that's going to go right around Emma's stoma, and I want to have a little bit of acetic acid on it, because this one is going to go on Emma. I'm going to put this one back inside the trach bag, because that gauze is the one that's going to go on Emma. I put it back inside the trach bag, just so it's nice and clean in that little sterile bag. Next, I'm going to use this satin powder, and I'm going to put it on the trach ties. So I put it there. You know, we use a lot, so that's why the table gets so white, but you'll see what we do next. Okay, now that that is covered, I'm going to bend this and just rub. Oops, it's stuck together. Sometimes that happens. They get too close together, they get stuck together. Okay, I'm going to rub that together. I see it's on there pretty good. I'm just going to tap it a few times. I'm just going to tap the other side of this trach tie to get the excess powder off of it. After that is done, I lay it over here. I'm going to rub this one together as well. It's easier with two hands, you'll come to find out. So, there, and those two are ready. So, my trach ties are ready. My Q-tips are ready. And my gauze is ready. So now I'm all ready for trach care, which I will not go over in this video. But I wanted to show you what we do for setting up for trach care with Emma. What we do with our supplies. Every trach and family is different. They're taught differently at the hospital, but this is how we taught and this is how we set up. Then we go over and proceed with trach care, and we also clean up our mess over here. Thank you for watching this video. I hope that you've learned something. Sorry it's all handheld. I will hopefully be getting something different to hopefully help with that. If you have any questions about what we do or how we do things, just leave a comment. We would also love it if you liked and subscribed to this video. It does help, and we're just looking to try to take care of our daughter in every way we can. And also help you take care of your daughter and your son, who also has a tracheostomy or tracheostomy and event. Thank you for participating. Bye.